welcome back to my channel. If this is your first time here, my name's Chelsea. I am a stay-at-home mom to an 18-month-old little boy named Sebastian, and I'm currently pregnant with another baby boy due May 31st, 2019. I am currently 22 weeks and 3 days pregnant. This is my 21-week pregnancy bump date. So I've mentioned before, two apps I really like to follow my pregnancy and the progression of the growth of the baby is the Ovia Pregnancy app and the Pregnancy Plus app. So according to my Pregnancy Plus app, baby is 11 inches long and weighs approximately 15 ounces. And he is the size of an eggplant. Now, Ovia Pregnancy says that the baby is the size of a baby bok choy, pretty much about the same size. So I want to go ahead and talk about some symptoms that I have been experiencing. This was probably one of the harder weeks of pregnancy that I've experienced thus far. The baby has started to move like crazy. I know I mentioned last week that I've been experiencing a lot more movement. And this week I was actually able to see the movement from the outside of my belly. If you haven't watched some of my previous pregnancy bump dates, I do have an anterior placenta, which means the placenta is right against my belly. So I struggle a little bit to feel movement in my belly, but in the lower pelvic region, I can feel movement of the baby. And he is very, very active. It's always really reassuring, that he's active and responds to certain things, like when I drink cold water, certain things that I eat, he just really seems to react a little bit more. And so it's really fun to see when those things happen, and just be able to kind of like soak in the movement. I've also been experiencing some nausea again. So again, in a previous pregnancy bump date, I had mentioned that I was taking Bongesta that was prescribed by my OB to kind of help with some of the nausea and morning sickness I was experiencing. And I do still take it at night. I find that my morning sickness or any sort of nausea I experience happens in the evening and into the middle of the night. So I am back to taking the Bongesta. There are some days that I do need to take it during the day. It's been a couple of days since I've really had to, but last week was definitely a tough week. In my 21st week of pregnancy, it was definitely tough for me to get up and not feel nauseous or as if I was going to need to run to the bathroom to vomit. And I think part of that may have been because we all had colds. There was congestion and possibly like nasal drip that could have been contributing to that. I'm not really sure. So as of right now, I'm back to taking the Bongesta. Sleeping has been a massive struggle lately. I did pull out my pregnancy pillow that I had bought in my first pregnancy, and I used it one time in my first pregnancy because it was incredibly uncomfortable. And I attempted to use it last week, and it was, again, just incredibly uncomfortable. I know some women absolutely love their pregnancy pillow, and for me, it's just not something that I can get comfortable with. I have been just putting a regular pillow like from our couch in between my legs in the evening, and when I sleep at night, it seems to really help with some of the back pain and the hip pain that I've been experiencing, which will kind of move into the next symptom that I was having. I was having a lot of groin pain, and something called Symphysis Pubis dysfunction was something that I looked up. This can be something that women experience in pregnancy when the pelvic bones, where they connect, there's cartilage between them, and that cartilage, due to the hormones that your body creates during pregnancy, can become a little bit more pliable, helps with the growing of the baby in the groin area, and it actually helps when you deliver to allow your pelvic area to expand when you go to push the baby through the birth canal. I was experiencing groin pain that felt like the Symphysis Pubis dysfunction, and I really thought for a day and a half or so that I was going to experience this through the rest of my pregnancy. Come to find out, I really just think the baby, he was kind of either had an elbow or a foot down in that area that was really uncomfortable. So my mom actually recommended that if I laid on my back and maybe tilted my hips up, he would kind of reposition in a way that I wouldn't be in pain. So that's what I did. It does, you know, offer a little bit of relief for me. It moves him just out of really being stuck down in there in the pelvic area. One thing that my OB did suggest was possibly a pelvic girdle that would kind of give me a little bit of support during pregnancy as my belly got bigger. My first pregnancy I did deliver via emergency C-section because my son was breech, and I was not consistent with working out and building up those abdominal muscles after that pregnancy. So now that I'm pregnant again, without building up those muscles, it can create a little bit of issue in that area when supporting the baby. So maybe in the future I'll need to get a girdle of some sort to be able to assist, I guess, with some of the weight that I experience in my belly. But for right now, I haven't had to buy anything yet. The acne, my skin is starting to change. So I do have a couple of active breakouts at the moment, but I'm realizing that my skin is getting really dry. And I don't know if it could be from the coldness that we're experiencing. I do live in Florida, so when I say cold, it's only about 40 or 50 degrees, but that is a huge difference for us. And the change happened very quickly this year. We went from about 70, 80 degree weather to 40 or 50 degree weather. The dryness could also be from dehydration. I do try to drink a Yeti full of water multiple times a day to try to keep my you know, body hydrated and make sure baby is doing well, and just really, you know, avoiding dehydration. So I'm not sure if the skin issues I'm experiencing are from the weather, if it's actually pregnancy, maybe hormones are shifting a little bit. So that's also something that has, I guess, been reoccurring. I do also have breakouts on my shoulders. They're kind of difficult to see in the lighting, and on my back, there are times where I will experience a little bit more acne as well. Again, attributing that to hormones. But I do tend to realize that once the active breakouts are gone in pregnancy, my scarring seems to take a little bit longer to heal. I'm not sure if that has to do with pregnancy, if it's just the way my skin reacts to this pregnancy or my body in pregnancy to begin with. But you can see these scars here, and I have a few back here. Those are completely flat. They're, you know, healed breakouts that I'm still recovering from. So the scarring takes a little bit longer for me to heal during this pregnancy. A few more things I've experienced. Heartburn has definitely kicked in. I did experience heartburn in my first pregnancy with Sebastian, but I didn't feel like it started as soon as this is. I do have to be careful with spicy foods, anything acidic, and how late I'm actually eating those things. I find that if I eat something like that for lunch, I do pretty good in the evening to not have too much heartburn, but if it's something that I'm eating for dinner, last week I made a buffalo wing dip, and that does have Frank's Red Hot in it, and I had to be very careful to either not eat too much, or something else I've been doing in this pregnancy is taking Zantac. The doctor recommends Zantac to prevent heartburn, and that's something that I took some with Sebastian, but I didn't realize then in that pregnancy that it was preventative. So most of the times I would take Tums because I would feel the effect of taking Tums a lot sooner than I would the Zantac. So in the evening I've been taking my prenatal, I take the Bronjesta, and I've also been taking the Zantac so that what I've eaten throughout the day doesn't come back to get me in the middle of the night. That's something that I experienced with my first pregnancy, so tempting to prevent that this pregnancy. I have gained 2 more pounds. So I'm at about 10 pounds weight gain. At this point in my pregnancy with Sebastian, I had already gained about 20 pounds. So I'm feeling like 10 pounds weight gain isn't too bad. I am heavier this pregnancy than I was in my pregnancy with Sebastian, so that may be contributing to my body already realizing that I have stored fat and that I don't need to put on the weight as quickly to support this baby. But weight gain is something that I've been concerned with, and I'm happy that it's only at 10 pounds, but I know that it's just going to continue to increase. So trying to incorporate some sort of exercise is something that is on my to-do list. So one of the last symptoms that I've been experiencing in my 21st week of pregnancy is constipation. And I had mentioned in a previous bump date about flatulence and, you know, the changes in your body. Taking a prenatal, taking a lot of vitamins can kind of stop the flow naturally of having bowel movements consistently. And in this pregnancy, I'm realizing that I am a little bit more constipated. I am using the bathroom every day, but it is uncomfortable at times for me. So I'm just, you know, really trying to focus on my diet and make sure that it's high fiber, you know, getting the best nutrients that I can for this little boy inside of me, and just hoping to, you know, prevent some of the things that can come with constipation during pregnancy, like hemorrhoids and some of other complications that you can have. So this is my 21-week bump. He's moving all around in there. I'm feeling pretty healthy. That's really it for my 21-week pregnancy bump date. I appreciate you tuning in. If you are interested in more pregnancy based videos, please feel free to subscribe and hit that notification bell so you're notified every time I upload. I try to upload 3 times a week, generally Monday, Wednesday, Friday. So thank you so much for joining again, and we'll see you next time. Bye.